Jagrut Lallu joins me now. He is here to tell me all about Orthokeratology. It is a brilliant new treatment for helping with sight and vision. Kia ora, welcome.
Thank you for having me.
Thank you for being here. Right, can we start by giving a little bit of background into what you do?
I'm basically an optometrist. I work at Vizic Rose Optometrists in Hamilton. We're a contact lens renowned practice. My boss, his name is Paul Rose, he actually invented a contact lens that's used in the treatment of an eye disease. Did that in about the early 80s, and his contact lens is used 75% of the world over and 95% of New Zealand.
Wow, that is pretty impressive. And so what are you working on at the moment?
So I joined the practice in 2009, and we introduced a specialty called Orthokeratology, or Orthokeratology. Now, initially we started on people who were short-sighted. Short-sighted is otherwise known as myopia, but essentially means that things close up are clear and things far away are blurry before you do any method of correction, so glasses, contact lenses, or Orthokeratology. We basically introduced the specialty, and we started on the tried and true, what we knew how to do. Since then, we've moved forward quite a lot, and we've now been able to introduce other sub-areas of this where we can now correct people who have something called astigmatism, which is kind of like when your eye is shaped more like a rugby ball than a soccer ball, and things maybe just have a bit of a fuzz on them. The other area we've been delving into and really having great success with is actually long-sightedness. Now that can most widely affect everyone that's over 40. They'll go to an optometrist and they'll say, oh, the readings started to become blurry and I've had great vision my whole life. So that's a long-sighted patient, or something else, a technical term is called presbyopia. But essentially they get told at some point in time between 40 and 65 that you need something for reading. So what the procedure is basically you sleep in a specially designed contact lens in the evening, you wake up, you take them out in the morning, and then you can see. You can see far away and you can see close up.
That's pretty amazing. That's almost like a little mini miracle overnight, isn't it?
Most people can't believe it when it happens. It's the biggest thing I get asked is, does this lens hurt at night? And because they're wearing something whilst they're sleeping. And the really simple answer to that is because you're not actually blinking with the lens inside your eye, there's no pain at all. The other question I get asked is, well, how does it work? You know, does it remold your eye, or what's happening? And the best way I can explain it is that it reversibly remolds the eye. So you take them out, you stop wearing them, your eyes go back to whatever they were. And the lens doesn't actually press on your eye in any such way. It basically uses your tears that are naturally on your eye to gently reshape your eye. So the lens isn't actually pressing on the eye, it's just creating an environment so that it can be remolded. Okay,
so how long will the remolded eye last? Is it going to take you from breakfast through to dinner? Is it going to take you a whole working day?
Exactly right, yes. So the biggest thing, the advantage of this is that you wear these at night, you wake up, during the day you've got great vision all day. Now, later on, after wearing them for a period of, let's say, a couple of months or more, I'm personally choose a couple of months for my patients, then we start altering the regime. So instead of wearing them every night, you may get away with wearing them Mondays, Wednesdays and Fridays, and every day you wear nothing. So that effect is kind of like braces. It just remolds the eye temporarily, but can last for up to 2 or 3 days. On the rare occasion, and by rare I mean exceptionally rare, you will have a patient who will just be able to wear them once a week, and then that's it for the week, and that's extremely rare. But it's possible. It really depends on how quickly your eyes want to remold back to normal shape.
That's fantastic. It's very heartening to hear that we've moved on from the big thick Coke bottles, the bottom of Coke bottles and glasses. We've moved into now technology that is so advanced.
Yeah.
It's very, very good to hear.
And the biggest thing as well is that it's now safe. You know, when contact lenses were first made and invented 40, 50 years ago for hard contact lens wearers, the biggest problem was having oxygen to your eye, and now we've come to a level where we've got breathable contact lenses which you can even wear in the evening at night, you know. So they're quite safe in that respect.
Absolutely wonderful. Now, where is your clinic based?
So we're based in Frankton. It's in Hamilton area. It's just by the Forlongs there, if you've ever been to Hamilton. It's called Physique Rose Optometrists. Our website is www.roseoptom.co.nz. If you want to find out more about Ortho-K, there's orthokami.co.nz, and also we have an 0800 number, which is 0800 Ortho-K.
Most fantastic, because we always like to hear about good things helping us to have better health, and sight is so important, isn't it?
Yeah. Oh, just thank you for having me on.
Oh, wonderful. Well, thank you very much for your time, Jagrut Lallu, and congratulations on such wonderful work. You're working with some pretty impressive people, and sounds like you're doing some pretty impressive work yourself.
Right.
Kia ora. Well, there we go. That's very good news, very heartening for all of us out there that may be struggling to see things. Pretty brilliant. Put it on in the night, and then in the daytime you're good to go. Well, thank you so much for joining us. Stay with us. Come back again after the break.